First, I'm going to say the wipe. I'm going to check my orders, the patient's allergies. I'm going to assemble and gather any needed equipment. I'm going to wash my hands and put on gloves. I'm going to introduce myself and identify the patient using 2 identifiers. And then I'm going to provide for privacy, educate, evaluate, and explain. Okay, so I'm going to put on gloves. This isn't sterile, but these are the only gloves I have with me. Okay, my patient is a male, and I'm going to start with his vitals. Normally I would use the bell of the stethoscope, but this one has a special feature. If you push down, it's basically like the same thing. Okay, and it's okay if the baby is crying when I'm listening to lung sounds, but when I'm assessing the apical pulse and everything like that, I might have to quiet him down. Okay. Okay. I'm going to make sure I listen each side. And this is also a good time to look to make sure that both sides of the chest are rising and falling evenly with respirations. Now I'm going to assess apical pulse, and while I'm doing these vitals, I want to assess for a full 60 seconds to make sure that everything is accurate. Okay. And this infant's apical pulse is 135 beats per minute, which is normal. His respirations are 45. And then I'm going to do his temperature under his armpit. I don't have that with me, obviously, but it's 97.8, which is also good. Okay, and then next I'm going to assess his reflexes. The first one would be the rooting reflex, where you put your finger along his cheek, and he's going to turn his head towards that finger and start open his mouth like he's getting ready to suck. Okay, so this baby, he has that reflex. And then I'm going to assess his grasping reflex and make sure I rotate my fingers in the palm of his hands, and he is grasping my fingers, so that's good. And I'm going to do the startle reflex. With the startle reflex, the easiest way is to kind of pull up and then let down, and the baby will stick out its arms and flex its knees automatically. So this baby's reflexes are intact. And then I'm going to measure. I did not have a tape measure, so I made my own, but I'm going to measure just at the eyebrows. Make sure you're being gentle with the skin, and you also try to do everything not rush, but pretty quickly, because they're not good at regulating their heat, and they're going to need to be, skin to skin or under an incubator or anything like that. Okay, so this is within range. It's 14 inches of what it would be on a average male pediatric patient. Okay, and then I'm going to measure right by the nipple line, which is also about 13 to 14 inches. Okay, making sure you're careful. And then I'm going to measure just at the umbilicus on expiration. Okay, and I'm going to document all the measurements. Okay, and now I'm going to inspect the skin, make sure everything is intact. This baby does have some acrocrinosis, which is a bluish tinge towards the fingers and toes. This is expected and normal. This baby would have an APGAR score of 9 due to a point being deducted for the acrocyanosis, but it'll eventually resolve and is expected. Okay, now I'm going to look at the mucous membranes. And I'm also going to inspect the sucking reflex. A good way to do this is inserting your pinky, or best way is if the baby's crying, that's another way to soothe them. Okay, insert. And you can also feel that his palate is intact, it's not too high. Make sure there isn't any openings or bleeding or discharge or anything from his mouth. Okay, now change my gloves and I'll get a pin light, and it says for Perla, and make sure that the eyes are symmetrical and that there might be a slight amount of edema, but that's normal due to just, you know, being birthed. Make sure there isn't any bleeding or sores or openings or anything like that. Looks good. Make sure his pupils are equal, round, reactive, accommodating to light, everything like that. Now I'm going to check his ears. I'm going to make sure that the ears, that the inner canthus is equal to the eyes. Make sure there's any drainage or any deformities or anything like that. All of that looks good. Okay, and then I'm going to check fontanelles and suture lines. I'm going to check the anterior fontanelle, which is typically right here towards the middle. Okay, and then there is a posterior fontanelle. I'm going to check towards the back. Check that. Make sure that the suture lines are normal and transient. Looks good. Now I'm going to inspect and palpate the abdomen and make sure there aren't any masses. I've already listened first. That's the most important thing, is listen and then palpate in case something was wrong in there. Okay, so I'm gonna palpate the abdomen. There aren't any masses or any abnormalities. I'm also going to rotate the hips while I do this and make sure there isn't any crepitus. Make sure they are moving freely, and you can also look and make sure there aren't any masses while you're doing the hips as well, while you get everything moving. Okay, all that looks good. And then I'm going to inspect the umbilical cord and provide any care if needed. The umbilical cord looks appropriate, it's not bleeding or anything like that. And then I'm going to, I couldn't find a diaper to fit this teddy bear, but if they had a diaper, I would remove it. I would inspect the circumcision if there was one, and this patient had one, and I would clean it if necessary with just some water. And I would make sure that there is an anus that is intact, there isn't any bleeding or anything going on there. And I would assess what the patient has voided. The patient has voided a small amount of that black tarry stool that newborns get, but it is normal and expected. I would clean the patient and put on a new diaper if necessary, which it is. Then I'm going to inspect the fingers and toes and make sure there aren't any webbing. Make sure there is proper circulation. Make sure all the extremities, fingers, toes, arms, legs, make sure they are even, symmetrical, and that they move is symmetrical as well. Okay. Then I'm going to raise the patient up and inspect the back. Make sure there's any bruising or anything like that. You can listen for lung sounds this way as well. Make sure that there isn't a abnormal curve in the spine. There aren't any abnormal tufts of hair or anything like that. Okay. Then I would inspect the ID band, make sure it is not too tight, make sure that it fits properly, it's not going to fall off. Sometimes infants have two, so I would inspect both. And I would document everything and get him worn.